Alright, ACL surgery was today. I had it at 11 a.m., so I arrived at the hospital at 9. They got me all situated, hooked me up with an IV, gave me anti-nausea fluid, and then a solution of water with sugar and salt to keep me hydrated because I had to stop any fluid ingestion after 7 a.m. and I couldn't have any food after midnight last night. So yeah, as far as I know, everything went smoothly. I wasn't able to see the surgeon after because he was doing more ACL replacements. So I briefly saw the anesthesiologist and he told me that everything went well, but I actually see my surgeon tomorrow morning at 8 a.m. So while I'm not excited to get myself dragged out of bed, I am looking forward to talking with him and seeing how everything went. Because again, obviously my ACL was replaced, but the menisci repair was sort of TBD when he got in there. So I'm very curious to know if he did suture up both the lateral and the medial menisci. So we'll find out tomorrow, and of course that'll sort of help me get a better understanding of what my rehab and recovery looks like for the early stages here. Yeah, as you can see, there's a pretty good amount of swelling. I don't know if this angle really shows it, but my right leg is quite ballooned up, which is to be expected, of course. There was just someone drilling in it. And it's red. I think that's the combination of swelling as well as the whatever the mixture is that they rub on it to sterilize it before surgery. I believe that's what that is as well. They shaved my knee before the surgery as well. That was kind of interesting. But again, that's just for sterile purposes, I believe. Pain levels right now aren't severe. I definitely feel it. But I did get a nerve block, which doesn't block out all pain, but it does obviously take it down quite a bit. Whereas a spinal, that'll get rid of all pain. You're pretty much paralyzed. Well, not paralyzed, but no sensation from the waist down. But I got a nerve block instead, so it does drastically minimize the pain, but it doesn't remove it. So I certainly can feel it. Yeah, the surgery was about 2 hours. I woke up very disoriented, which wasn't a great feeling. It took me a while really to come to, and there was actually quite a bit of pain when I woke up. So the nurses monitored that, and when I told them what the pain level was at, they decided to give me some fentanyl, actually. Obviously a very, very, very minimal dose, but they put that through my IV, and that kicked in pretty quickly, being intravenous. And then I was prescribed an opiate. I can't recall the name of the medication right now, but I have it beside me, so let's see. Tramadol. Tramadol was what I was prescribed, taking 1 to 2 every 4 hours, but obviously I'm just going to take it as needed. I'm thinking that'll be pretty much every 4 hours for the first couple of days, but of course with something like that, you don't really want to be taking that for a long period of time if you don't have to. But for myself, the pain is pretty high, so I am going to take that, and hopefully that'll help me sleep and whatnot. But yeah, for reference, about 8 o'clock at night tonight, I just had a tiny little nap, so that was kind of nice, because I was very groggy after the surgery. It was nice when my wife came and picked me up and brought me home. My recovery time at the hospital was only about an hour and a half, so they get you out of there pretty quick, so I really wasn't up to snuff for a little bit. But once I got home and laying down, I started to feel much better, aside from obviously the pain in my knee. But yeah, it feels good to have had it done. You know, I'm officially on the road to recovery instead of sort of being in no man's land of waiting for my surgery for 3 months there. So I'm grateful for that. I know it's going to be a struggle, just as much mental as it is physical. So that's at least what I've heard. So yeah, I just gotta stick to my rehab. I go to physio in just 2 days, actually. It's important to get moving right after, you know, to help the inflammation go down a little bit and to pump out the pooled up blood and bring a new blood supply to the knee. So I'll be doing that in a couple of days. And then again, I see my surgeon tomorrow morning, so I'm definitely looking forward to that. Alright, so here's the leg. In my opinion, it's, well, wow, from the sun coming in, it's really emphasizing the redness. That is, I believe, the cleaning, whatever the sterile solution is that they rub on it. I don't think that's actually inflammation. But obviously you can tell it is still inflamed, but I do actually think it's gone down a little bit as far as the swelling. My calf, I noticed, is a little bit kind of ballooned up and there's some bruising there. That's normal. I think that's just where the fluid sort of collects because of gravity. But yeah, it looks pretty good. As you can see, I don't have my bandage anymore, and no brace either. They didn't give me a brace. They said I didn't need it, so honestly I'm okay with that. You have to be very careful, obviously, not moving it around too much beyond the limits that it has, but it is kind of nice that the skin's exposed because I can ice it really well. And it just gives me freedom to move it around a little bit, pump some blood in and out of the joint space. So yeah, I'm okay with not having the brace on. But yeah, the main things that I got from today after seeing the surgeon was in regard to my menisci, because they were both torn, so I was very curious as to what he did for them, and it was actually pretty minimal. So my medial meniscus, again, was torn, but it was actually at the vascularized portion of the meniscus, meaning that it had the capacity to heal, and he could see that it had already it was already healing when he looked at it, because again, my injury was 3 months ago. So he said it was healing up very nicely. He probed it, and it didn't displace, which told him that it's stable. So he did not have to suture it. He said that'll heal up. I shouldn't have any issues with my medial meniscus, so that was great. As per the lateral meniscus, that was also torn, but it wasn't on the periphery. It was on the inside, meaning that it was in an area that isn't vascularized, meaning there's no capacity to heal because there's no blood supply. So there's no point in suturing it because, again, it wouldn't heal. So what he did instead was just trim away the torn parts. But he said there shouldn't be any long-term implications to this. He said the meniscus was still highly functional. He said my risk of osteoarthritis is very low. So all things considered, the meniscus involvement in this injury ended up being pretty minimal. So very, very happy to hear that, because that means I can weight bear as soon as I'm comfortable with it. And that's obviously going to help me in my recovery. So I was very pleased to hear that the menisci are A-OK. As per the ACL replacements, he said that it was like a textbook surgery. There were no issues. It went very well, which I was really happy to hear. He actually said that there was a surgeon in training who was observing my surgery, and he said it was my case was the perfect example of just a flawless replacement. So I was very happy to hear that. He said the anatomy was in good shape. He said everything went well. So I was very, very, very happy to know that it went smoothly. I also got answered why I wasn't able to extend my knee. If you watched my first video, I noted that I was stuck in a certain position, not unable to lock out my knee into extension, which was really driving me bonkers. And that was 3 months like that I was never able to lock it out. And he told me that that was because when my ACL ruptured, it sort of recoiled and then sort of formed a little stub in the joint space, so that when you go into extension and your tibia and femur come together, it was between them, so it was blocking them. So that's why I couldn't extend it. So obviously he got rid of the stubs, and I've got the new ACL in there now. Oh, more like tendon, but yeah, that was good to find out. So I shall be able to restore extension, which I'm very excited about, because obviously that's important to do after your surgery, is to restore that extension first off. So I'm looking forward to working on that. You would have seen the clip of my stitches. They all look pretty nice and clean. Obviously they're bandaged up now, but for reference, there's incisions there, there, and there. Those were the openings into my joint space that they used. And then there's a long incision here. You can see it's sort of still bleeding, but that's, I think, pretty normal. This incision was what they used to get my grafts. When they first took the bandage off, I was feeling in the back of my hamstring going, I don't feel any stitches, and I briefly panicked. I thought maybe they didn't replace my ACL, but they did. They just used it from here, because the two tendons that they got were the gracilis, which comes just right up your thigh, and then the semitendinosus, which is one of your hamstrings, wraps around. They both attach to the tibia here, so they just went in right from the tibial attachment and took those two tendons and made a new ACL out of it. Drilled a hole through the tibia and through the femur, I believe, and then brought the graft through and put it in place. And then they closed the femur with a staple, and they closed the tibia with a screw. So I've got some hardware in me. The staple, he said, will be in there probably the rest of my life. I'm not going to notice it. He said the screw, for some patients, they'll notice it about a year later. I think it starts to surface or something. I'm not entirely clear on that, but he said if it becomes an issue, then he can replace it. It's not a problem. So yeah, everything went well, and I'm very happy about that, because now I can start my road to recovery. As far as pain goes, honestly, it's been pretty minimal today. I'm happy about that, because I think by now the nerve block is probably worn out for the most part, because it's been over 24 hours. It is 7 p.m. right now. The last opiate I had was at 11:30, so coming up on 8 hours now without a painkiller. So that's cool. At this point, I'm not really doing the every 4 hours thing. I'm just taking it as needed. So I might take one before bed just for precautionary reasons, but yeah, as long as it's not driving me nuts, I won't take it. So who knows, maybe the nerve block is still in place and I'll wake up in the middle of the night in agony, we'll see. But so far the pain has been tolerable, so that's really nice. Hurts a little bit when I move it, of course, because it was just operated on, but I'm not moving around too much. I'm doing little things like a little bit of quad activation, like you can see there. I've got the towel under my knee because that's the most comfortable position, but I have actually been moving it to go underneath my Achilles there, obviously towards my heel. Putting it there just to draw my leg into a natural extension under gravity, because of course, again, that's something that they emphasize that you want to get back to pretty quickly after surgery. So I've been doing that, wiggling my foot around a little bit, just to help sort of promote some fluid movement, because again, it's sort of pooling in my calf right now. And yeah, that's pretty much it. Not a bunch of motion other than that, but I see my physio tomorrow, so obviously they will assign me some stretches that I can do, and yeah, I'm excited to do those. I know it's a long journey ahead of me, but to have the surgery done and it being successful is really nice, and I'm excited to go through the process and eventually get back to doing the things I like. So yeah, I'll keep documenting my progress. Maybe I'll start cutting down videos to sort of weekly updates or whatever. It's fun to do, keeps me sort of accountable to rehabbing, and yeah, I'm enjoying it. So thank you for tuning in. Feel free to ask any questions, and yeah, see you next time.